Complications of eyelid surgery include those that are going to be occurring during the operation, which is unfortunate potential loss of vision whenever we operate around the eyes. That is extremely, extremely rare. The patients can have excessive bruising, bleeding after the surgery. Again, we minimize that by making sure that the patient's blood pressure is controlled before the surgery and during the surgery, after the surgery. Within a week or so, infection can happen. Very rare in the eyelids after the eyelid surgery. On a long-term basis, the lid can get pulled down. If that occurs, it can be corrected. That usually means that either the skin was removed too much, or the patient formed a scar tissue in the eyelid, or one thing was missed, and that is the tone of the lower eyelid that I mentioned earlier. Often, actually, in conjunction with the lower eyelid surgery, we tighten the tendon that holds the lid up, supports the lower lid up, and it is connected to the bone, and it's like a sling going all across the lower lid and holding it up. And we tighten that if it is loose to minimize the potential for the eyelid being pulled down. There are patients who are prone to having that kind of condition, and we need to detect that. We need to be aware of it, and we minimize, again, deterioration of the lower eyelid tone after the surgery. Those are the things that the patients can experience. Nobody should wake up not being able to see. Again, the vision will be blurred. If there is a problem seeing, the doctor should be informed immediately. But fortunately, that is incredibly rare. As I said, in 44 years that I've been doing this surgery, I've never seen one.